398. A specimen for routine urinalysis must be delivered to the laboratory following collection within how many minutes? 120 minutes, so within 2 hours. 399. If a phlebotomist uses a sterile cotton swab to brush a patient's tonsillar area and the posterior pharynx, what specimen has the phlebotomist collected? Nasopharyngeal culture. So that's NASOPHARYNGEAL culture. 400. Arterial blood gas specimens require special transport to prevent changes in what? pH levels. Remember, anything that deal with blood gases, pH levels. 401. Which of the following analysis is always transported and analyzed stat? ABG. 402. The term that means immediately is stat. 403. Blood specimens from which patient unit are always handled as stat request? ER. So patient from the ER. 404. Which of the following analysis requires the patient to fast prior to collection? Cytomegalovirus. So cytomegalovirus is spelled CYTOMEGALOVIRUS. 405. Which of the following analysis requires the patient to fast prior to collection? So it's just like the top, and it's 3 questions with the same thing. So I'm just going to name them. Which of the following analysis requires the patient to fast prior to collection? One would be cytomegalovirus. Next one is serum gastrin. And the next one is triglycerides. .407. The department in the clinical laboratory that identifies disease of blood forming tissues is hematology. .408. The department in the clinical laboratory often housed in the hematology department that monitors medication given as anticoagulant therapy is coagulation department. .409. The department in the clinical laboratory that cultures and identifies bacterial pathogens is microbiology. 410. The department in the clinical laboratory that analyzes antibody-antigen reactions prior to the transfusion of blood or blood products is immunohematology. 411. The department in the clinical laboratory that assesses the body's response to certain infectious diseases through the analysis of antigen antibody reactions is immunology. 412. The department of the clinical laboratory that conducts testing of the antibodies and antigens associated with hepatitis and certain hormone and drug level is radioimmunoassay. 413. Let me spell it. Let me spell radioimmunoassay. It's radioimmunoassay. 413. The department in the clinical laboratory that screens for the early detection of cancer cells is cytology. CYTOLGY. 414. The department in the clinical laboratory that prepares and processes tissue samples removed during surgery is histology. 415. A test commonly ordered to assist in diagnosis of cystic fibrosis is sweat chloride test. 416. A patient has a chloride level in his or her sweat that is 5 times the normal level. What clinical condition is most often associated with this finding? Cystic fibrosis. 417. The process of introducing ions into the skin through the use of electrodes placed on the skin is called ion tophoresis. 418. It's spelled IONTOPHORESIS. 418. To accept a specimen for trace metal analysis, the specimen should be collected in a what? in an acid washed plastic syringe. $4.19. List below are colors of Hemogard stoppers for evacuated tubes. Which Hemogard stoppered evacuated tube is most suitable for lead level determinations? Brown. I thought it was tan. I guess tan and brown is the same thing, huh? I don't know. 420. List below are colors of Hemogard stoppers for evacuated tubes. Which Hemogard stoppered evacuated tube is most suitable for zinc level determinations? The answer is royal blue. 421. To accept a specimen for fibrin split product analysis, the specimen should be collected in a trombo well Cotes tube. So it's trombo-well Cotes tube. So that's THROMBO-WELLCOTEST tube. 422. Which of the following test procedures is preceded by a GTT? So it means comes before a GTT. The answer is lactose tolerant test. Wait. Which of the following test procedures is preceded by a GTT? So it means the GTT come before that. It's preceded by a GTT, so it means it comes after A, B, C, D, F, G, H, I. Okay, so just remember GTTs first, and then it's a lactose tolerant test. So when it's a glucose tolerant test and lactose, so just remember G comes before L in alphabetical order, and that's to remember that lactose tolerant test proceed. Which of the following test procedure is preceded, and preceded mean before, is preceded by a GTT, which means comes before? I don't know. Anyway, 423. According to NCCLS, what is the maximum time that may elapse between collection of a blood specimen and separation of the cells from the sera? 2 hours. So I guess between collection and centrifuge, 2 hours. 424. Which of the following test results will be affected by glycolytic action of the red blood cells? Glucose. 425. A specimen for glucose analysis is collected in an evacuated tube with a red stopper. The specimen was not processed in a timely fashion. As a result, the serum glucose values did what? Decrease. (426) A specimen for glucose analysis is collected in a red stoppered SST evacuated tube. The specimen was centrifuged promptly, but not analyzed in a timely fashion. As a result, the serum glucose value did what? Were actually unaffected, because it was centrifuged in a timely manner. It's when it's not centrifuged in a timely manner, then the value decrease. But as long as it's centrifuged in a timely manner and it's glucose, I believe it could sit up to 24 hours, and if it has potassium oxidate, it could sit up to 72 hours, something like that. 427. A specimen for potassium analysis is collected in an evacuated tube with a red stopper. The specimen was centrifuged promptly, but not analyzed in a timely fashion. As a result, the serum potassium values did what? Increased. Remember, the potassium is different from the glucose. So most things with electrolytes, pH, air, gas, it have to be in a timely fashion. Okay. 428. A specimen for potassium analysis is collected in a red stoppered SST evacuated tube. The specimen was centrifuged promptly, but not analyzed in a timely fashion. As a result, the serum potassium values did what? Were unaffected. The reason why it was unaffected, because it's a serum separator. It was centrifuged promptly and the serum was separated. So there's nothing to mess it up. 429. What advantage does a pneumatic tube delivery system offer? Pneumatic tube delivery system offer what advantage? Decreases specimen delivery time. 430. If a specimen is left uncovered, which of the following test results may be affected? Alcohol.